Hello, I'm Dr. Dave Bullis. I'm the Director of Ambulatory Behavioral Medicine here at the Cancer Center. This is a series of videos to help people walk through the survivorship process once you're done with active cancer treatment. So this first episode is just an introduction to the general topics of survivorship, and then in subsequent episodes we'll get into more specific concerns and how to cope with them. So this is Introduction to Survivorship, the What's Next class. So there's a couple of things just to keep in mind. The two hardest parts of cancer treatment turn out to be the time between finding out that you had some form of cancer on a scan, a blood test, or some exam, and then finding out what the initial treatment plan is going to be. And the other time is after you've completed all the treatments and the staff have told you there's nothing left to do for the time being, and you don't know what's going to happen next. The thing that those two timeframes have in common, no control. And why do you have no control? Why does it feel like that? Because of all the uncertainty. And this number two item, after you've completed all the treatments, that's really all about survivorship. So the purpose of these videos is to really give back some sense of control by addressing some of that uncertainty. So what is survivorship? First, a couple of just general themes. So there are a variety of opinions about it, about when it starts or when you think you're in it. The current thinking is basically survivorship refers to any person with a history of cancer from the time of diagnosis through the remainder of their life. That is the American Cancer Society definition. And then other people have talked about sort of phases of survivorship. One is from initial diagnosis to the end of active treatment. The next is transition from active treatment to post-treatment life, and then there's long-term survival. And I think when people in our clinic think about survivorship, it's really that second transition that's the hardest. So that's a lot of where we'll be focusing our time in these videos. So the good news, right, is that oncology has been very successful. So we have been able to get to a point where we have many, many, many more people living with cancer and a history of cancer than we ever have in the past. So that's good news, right? More people living longer and having more productive lives. The catch here, of course, is that means managing maybe more side effects or managing side effects for a longer period of time. And that's where people really are struggling. No one's really upset about living longer. It's more just that there are consequences to that. And some of those we don't even know yet. As the treatments unfold and new treatments are coming online, we won't know what some of those side effects are going to be. So that unknown is where a lot of the uncertainty comes from. So who are these people who are surviving? So this is a very busy slide, and it's probably more information than anybody needs. But the bottom line is, if you look at from the last, so from 2016 up to what we expect in 2026, for men, there's over 7 million people who are going to be living, who are currently living with some kind of cancer diagnosis of any sort. And that's going to balloon up to over 9 million, almost 10 million people in 2026. For females, they're already at the 9.9 million, almost 10 million, and that's also going to balloon to over 10 million people over the next decade. So the point of this slide is really just to underscore that you are not alone, that there are many, many, many people who are living with a history of cancer and cancer treatment. And that's why this is such an important issue and a burgeoning issue in the cancer treatment community. So there is a couple of sort of key senses of what are the components of survivorship care. One is to prevent new or recurrent cancers or other late effects from the initial cancer treatment. There's surveillance, or being on the lookout for any possible cancer spread and keeping close eye on that. There's number three is assessment of any longer term or late arriving psychosocial or mental effects. And we'll go into more of those details in a little while. And then there's treatment of the consequences of cancer and the treatment, side effects, medical complications, emotional distress, financial and social struggles, which are outside of the normal purview of the medical community, but are certainly a part of the life of people in survivorship. And then The fifth is really coordinating and shifting the responsibility for active daily care in between the primary care provider, who is managing the rest of your medical care, and your oncology specialist. And with here at Vernon Cancer Center, we do use the electronic medical record, which allows that to be more fluid, but it is an ongoing concern of making sure that the primary care providers are aware of what you've been through. So treatment plans that you've been through so far, and that's whether somebody is had just had surveillance or surgery or chemotherapy, radiation, immunotherapy, hormonal therapy, gene therapy. These are all the various kinds of treatments that people have when they're in active cancer care. And then the question really becomes, how are any of those going to affect you over the long run, and what are the effects of that? There are obviously new treatments coming on board basically almost every week or month. So this is an ongoing and very dynamic list. So the survivorship care plan, which we'll go over next, is really just a way of tracking what you've been through so far, and really then highlighting what some of the follow-ups are going to be from a medical perspective. We also want to talk about what we'll be talking about in these subsequent episodes is what some of the physical side effects are and how to manage those. Also, some of the mental effects that happen as a result of cancer treatment. And then also emotionally, what are some of the things that what are common challenges that people face? And we want to think about how to manage those proactively. The overall goal here is to help you put together a really coherent and cohesive and comprehensive survivorship coping plan. And then we're also going to go over other additional resources and other topics. So that is the general overview of what is yet to come. So we hope you stay tuned for that. But in the meantime, just to go over the basic idea, there are three parts of all of us. And there's our physical health, our mental or cognitive health, and our emotional health. I show it here as a diagram as a pillar, and the bottom of the pillar is the physical health, and of course that's the most important. And if the bottom of the pillar is wobbly, then everything else is wobbly as well. And so after going through cancer treatment, you may well be familiar with feeling the physical effects, but also these are the emotional and mental effects as well. And our survivorship episodes will go over each of these in more detail. The physical is really taking into account all the basic parts of ourselves, so all the organs, but also pain, fatigue, your ability to have your strength back, endurance, bowel and bladder, other things like that. Your mental capacity is really thinking about how you're thinking and whether there's chemo brain or other kinds of distraction. There's how organized you can be and your ability to sort of stay on track and focus. And then also what we think about in terms of, are we thinking a lot about the past or the future? How are we thinking about our current day-to-day? Managing expectations is another major component of the mental survivorship task. And then emotionally is sort of what you'd expect, right? Which is, why are we feeling this way? What are we feeling? What's normal versus a, quote, mental problem, unquote. Then there's also, for some people, a lot of feelings from the past come up and future worries. These are all the normal parts of it, and we'll go into more details about that as well. So a survivorship plan, and the question really is, well, why do I need a plan? Can I just move on and leave it all behind? And I guess the answer is that having a plan is really the best way to fight uncertainty. And as I said in the earlier slides, uncertainty is really the core challenge in survivorship. And so having a plan allows you to really reduce that uncertainty to its smallest amount. We can't ever get rid of uncertainty 100%, obviously, but we want to make sure that we have as much control as possible. So when we look at a plan and what we hope to have in a plan, an overall sort of full-on survivorship plan, we want to help and focus on what your strengths are and what you can use to overcome any residual limitations. And we want to focus on all aspects of yourself, your physical, mental, and your emotional wellness. So this is just a very basic idea. On the left-hand column, there's the three parts of your body: your physical, your thinking, and your feelings, physical, mental, and emotional. And then we want to think about what are your challenges, and then what coping strategies or what strengths do we want to try to tap into to overcome those challenges. And we'll go over this in a lot more detail in subsequent episodes. So that's the first episode, first introduction. Please stay tuned for more episodes around survivorship.